We are going to talk about the Association of College and Research Libraries Information Literacy Frame, Research as Inquiry. Inquiry focuses on questions that are open or unresolved. The research process is iterative. It begins with asking simple questions and progresses to asking more complex, sophisticated questions. It is important to maintain a spirit of curiosity, to be open-minded, and to think critically in formulating your PICO question and in examining the results of your search. Be flexible and adaptable in building searches and understanding results. You want to consider a variety of combinations of search terms to get the best results. For example, be flexible in how you describe your population and intervention in a PICO search. What terminology is used and preferred in the database? Research is open-ended, and researchers must re-engage with information to find the best answers and results. Questions often lead to more questions. Whenever you attempt to answer a question, you are engaging in a cyclical process like the steps you follow in evidence-based practice. The steps of assess, ask, acquire, appraise, and apply. As a novice researcher, you may be most familiar with Medline PubMed because this is where you often start. As you become more of an expert, you will begin to consult a variety of databases and other sources of information. Using mesh terms in addition to keywords in PubMed will improve your search results. You can learn more about mesh on the Medical Center Library Database Searching Skills page, your course guide, or from a medical librarian. Use field tags in your searching and note that syntax will vary across databases. Also, it may be necessary to change search parameters to get the best results. Analyze your results and refine your terminology. The range of inquiry includes simple questions that depend on review of knowledge to increasingly sophisticated and refined research questions. How you interact with research will change over time. For example, a novice may ask, what are the symptoms of gastroparesis? For this type of question, you may consult resources like UpToDate or First Consult. On the other hand, an expert might ask, what are some appropriate therapies for diabetic adult patients diagnosed with gastroparesis? Experts may use resources like UpToDate, but will also consult with information professionals or conduct literature searches in databases to tailor treatment to a specific patient. These searches may find differing views, and the expert will analyze the information for pros and cons of different therapies. Extending knowledge in a field is a collaborative effort. Disagreement and debate work to deepen the conversation. Maintain these qualities of curiosity, open-mindedness, critical thinking, and flexibility to be successful in your interaction with research and knowledge creation. Research novices work to acquire strategic perspective on inquiry and have a greater repertoire of investigative methods. Experts see inquiry as a process that focuses on problems or questions in a discipline or between disciplines that are open or unresolved. Experts also recognize the collaborative effort within a discipline to extend knowledge in that field. Finally, ask for help when you need it. Apparent dead ends can lead to new questions and new lines of inquiry. Contact a medical librarian for assistance by emailing mclib@uky.edu.